Good morning, everybody. Thank you for joining us for our integrated eligibility series. This is number 12 in the series. And today we have a little bit of a different topic. We have our OEP team here to speak to us. That's Oregon Eligibility Program. And they will tell you more about it and they will tell you who they are. But really today we're here to talk about the backlog, which many of you have experienced, some of the solutions that the OEP team is implementing for that backlog. And we have some questions for you because we want to hear you as community partners, what your experience and ideas are. So today's presentation is going to be about 20 minutes, plus or minus, with lots of time for question and answer, because that's what these IE webinars are all about. So with that, I'm going to pass it over to Nate Singer to lead us today, and our CPOP team will manage the questions and chime in as we need to. So Nate, thank you for being here.
Thank you so much. It's great to be here. Really appreciate this opportunity. So let me introduce myself really quick, and then we'll have Chrissy, Joe, and Maria introduce themselves as well. So I'm Nate Singer. I use he, him pronouns. And as we talk about this work, this is an interesting title. You know, it's an integrated eligibility series. And so I want to take a second to frame up where we are and what my role is in the Oregon Eligibility Program. So as we talk about this integrated eligibility, I've been with ODHS now for almost 16 years and have had 14 different jobs in those years. Have done a lot of different things out in our offices, working with various areas of support. And as we look at it, the last several years, I was on the Integrated Eligibility Project. Integrated Eligibility, our goal was to take the one system, the work you all had experienced with Magi, and really bring it together so that way we had a spot to open more doors for Oregonians. It was really to, as the name said, integrate our eligibility. As we did this work, we didn't do something in Oregon that most states did instead. We didn't bring our business together first. And so as we brought a system together, we have a system that integrates across, but we still have staff that work in SSP or APD or AAA offices that do the eligibility work. We have policies spread out across agencies. We had operations, our hearings, our IT, again, spread out in different parts of our agencies. And so what we decided over the last year as we talked with Pat and Fairboards and various leadership across ODHS and OHA was we needed a way to coordinate this more. If we're going to integrate eligibility, not just from a system, how do we really bring it together? And so while we call ourselves right now the Oregon Eligibility Program, it really is a partnership. And that's the P word, I want us to focus on. So I'm the director for the Oregon Eligibility. I'm going to use that word partnership as we look at this. My goal is to be able to bring key information and be able to help lead as we pull together our central functions to support the one system and doing eligibility across the state as we do this work. I'm going to turn it over to Christy Joe and then to Maria Ross to introduce themselves, and then we'll get started.
Hi, thank you, Nate. I'm Christy Joe Williams, she, her pronouns, and I am joining Nate with the Oregon Eligibility Partnership, I like that, as the statewide delivery manager. So I will be working with policy groups as well as direct service delivery offices to really build more partnership and to really talk through the operational piece of how we support Oregonians engaging in our integrated eligibility system. And nice to be here. I'll turn it over to Maria.
Hi, good morning, everyone. Maria Ross, she, her pronouns, and I am in the Director's Office of Oregon Department of Human Services after actually leaving Oregon Health Authority after almost 5.5 years there. And I am helping support both the project of building the eligibility program and also helping with the backlog. So good to be with you.
All right. So for today, our agenda, what we hope to be able to go over is review the one backlog and data dashboards. I wish there was another reason if we were having our first meeting with you all, but my goal is always for us to be transparent with you, to be able to share information. So appreciate just having the forum and being able to be here. We want to talk about our strategies for remediation around the backlog. And then really, as was shared, open up for questions from community partners and look at the poll everywhere to identify future needs and hopefully other opportunities to come back to engage with you all and have conversations. Next slide, please. So as was mentioned, if we could have you all please answer or put questions in the questions box. We'll answer everything we can. We'll continue to work through the questions. During the presentation, we're going to talk through the presentation, and then as was shared, the majority of time will be questions. So we're going to try not to jump into the questions during the box. I'm saying this more for myself. For those that have worked with me, they know I just want to start jumping into questions. So I will stay focused to make sure we get you all the information as parts of the presentation may answer some of the questions you ask. Go to the next slide.
Yep, and Nate, I was planning on you sharing your screen, so we're going to go, the next slide is the poll everywhere, which we'll use later. Would you like to share your screen right now?
Yes, let me make sure it will show here.
Yep, I can make you a presenter as soon as you're ready.
All right. Let's, yes.
Okay, here we go. Coming your way.
Okay. It always takes me a second, everyone. Sorry.
It's taking the system a minute because I had to give it permission in several different places. So you should, in theory, have, oh, maybe that didn't work. Bear with me. Oh, no, it did.
All right. I can't tell which screen is it showing a screen and which one is it showing you all.
It's showing your email.
Showing my email. That's good. That's fun. That's always fun.
It was just showing your calendar invitation for this webinar. No
That's
privacy.
always good. I know. Say no privacy. Things have been broken. Can you see this one?
Yep, there it is.
All right. I'm going to share it from this view from the chat here. It's just easier for me as I go through it. So if that works for everyone, I'm going to move through from there. So this is a similar deck of information that we've been sharing with legislators or other individuals. Some of you may have got it shared from other partners, so I just want to be able to share that as we move through this and go through the details today. So as we look at this, what is happening? And as you all are aware, as we really talk about the backlog, and hopefully my pop-ups don't pop the whole time it's lead session and meetings. We have a backlog currently of applications. In December, we reported we had 28,000 that were past their processing timeframe. And I want to take a second to describe what we're describing there as we talk about applications past their processing timeframes. As we look at each of the programs, whether medical, food, cash, or childcare, each of them have a time frame that we're legislatively or federally required to process the applications. For medical, it's 45 days. For food assistance or our SNAP program, it's 30 days. Some of those could be expedited, so you have up to 7 days. We have cash that is, usually 30 days. Childcare, again, each of these have a time frames. Domestic violence services, as you see at the bottom of the list as we go through this, that actually has a 12-hour turnaround for us to be able to take action on those applications. And so each of these are an application that could represent many individuals. We know as individuals apply, they could be applying for a whole family, but we're really focused on applications where individuals don't have benefits. We also have just task work that we need to be able to do. These are changes coming in, redetermination work, and other work. And so as we looked at this, as we mentioned in December, we found 28,000 applications that were past that processing time frame. And so as we explored that, here's the breakdown to where we are today. We've seen a significant drop in these applications through some focused efforts that we'll talk about. Currently today, there's 11,431 applications past their processing deadlines. You can see the breakdown with 7,204 for OHP and then across the other programs. We're also just on support on the call wait times, as that's an area I know you all usually have to interact with, and something that the individuals you help support struggle with at times. Our call wait times, we have seen those drop. We were able to bring on some additional, as you'll hear, temp employees to assist with this. And so as of the week of February 13th, our average time went down to 4 minutes for the support staff and additional 9 minutes for eligibility and other specialized help. Those had been closer to 20 minutes. We have seen highs, just to be fair and own it across, we have seen highs, between 120 to 130 minutes um, in those queues. But again, this is an average as we look at it, so you can see where we have been able to drop down some of those averages as we've been implementing some of these strategies. So why is this happening? Let's talk about why this is happening. Couple key factors as we look at this. This really is an unprecedented demand. When we talk about the current caseload and number of Oregonians we're serving more individuals in this state than we've ever served across these programs in the history of these programs. I've been with the agency for 16 years. I've worked with plenty of people that have been here longer than me than that. We've never, when we had OHB standard, when we had plus, when we had all the variations of our programs, we never had this many individuals open on our benefits or this many applications that we know of coming in at any period of time before this. OHP applications are up over 28%, ERDC applications over 26%, SNAP applications up over 10%, and beyond that, we've been doing pandemic benefits. So PEBT benefits, those were our pandemic EBT benefits that went out based on schools through the school information for individuals to assist with meals and to be able to provide that functions for individuals while we were remotely at home and over summer. Those brought in a huge new volume of calls and work, but also new individuals that hadn't previously engaged with us as an agency. And so those created opportunity for increased demand as well as special TANF payments have been issued, and we've also issued more benefit dollars than we've ever issued previously. So that we have this unprecedented demand, just huge demand that we've seen. Next is insufficient staffing. This is truly, as you think about it, a supply and demand situation of what can we keep the capacity to meet this demand. And our staffing isn't where it needs to be. When I started with the agency, and sorry to do this, but just from my history, when I started from the agency in self-sufficiency, we had for every one case, 250 workers as a ratio. In aging people with disabilities, we're at a 1 to 350 or 1 to 500 person ratio. As you can see here, we've had our ratios go up to almost 1 to 1,600 cases. That's 1,600 cases for every one eligibility worker. And so this type of demand, even with any efficiencies and options we have with the system, really makes it difficult for us to be able to provide that level of customer service and keep up with this level of work where we have, as well as the pandemic impact on our eligibility staff. Similar to you all and to each of us, childcare limitations, in-home learning, remote work, all of this has added stress to staff and our ability for them to be active and present, to be able to do that work in our offices. Those added to our areas and pain points that we've seen. As I talk about unprecedented demand, it's also important to point out, as we've been sharing with groups, the number of applications coming in. Starting especially in September, we see almost 10 to 15,000 per month application jump from what our averages had been previously. These are new individuals applying. We're seeing approximately 67,000 new applications every single month. That is a huge increase over the 40,000 or so we'd previously seen. Open enrollment in other areas placed increased demand during this previous wintertime, more than even I had expected, knowing that we'd had a longer period of open enrollment available to us during the pandemic. And then finally, system changes in these challenging times. We launched the integrated version of one in February 2021 statewide. That's a year ago. We are in February 2022. And so it's just been a year. But when we launched that and went statewide, we did so during a pandemic, without the level of support that we had anticipated for staff, the ability to be directly with them, to be able to sit next to them and be able to guide through it, staff having to move and work from home and figure out how to utilize technology in that way and engage with individuals that still came into our offices, added some additional stresses to our systems. But we went live because we wanted to reduce inequities in access to benefits. Previous to one, individuals had to apply online for some programs and not be able to apply for other programs. They had to go to multiple offices. We had multiple, even more paper applications, multiple different doors. If you applied, as you all know, for medical, you either went to an APD or AAA office, you called the OHP processing center, you could apply through one, but it didn't connect to our other systems. And then you multiply that by the hundreds of thousands of other cases for SNAP, TANF, and ERDC. We drove Oregonians to lots of different places that wasn't coordinated, and we needed to open that up. And I truly feel without opening that, we would not have been able to do the things we had to do during this pandemic. The ability to leave cases open, not reduce for medical, the ability to take actions and produce some of these pandemic benefits would not have been possible if we hadn't lifted that forward. But as we look at it from a slide perspective, this is just a snapshot of OHP to put a finer point on what that looks like. If you can see in this growth of this chart, that is what we've experienced. In many ways, this is wonderful. We've been able to produce and lessen the uninsured rates, provide access, but keeping up with staffing that's seen this sharp of an increase in the number of individuals on just the Oregon Health Plan, let alone the other programs, has been difficult for us to keep up with. I would love to tell you that this is all going to solve itself, and as you all know, it's probably not going to do that. There are actions we are taking that will help with this, and there are actions that we've seen that are helping as we move through this. But I wanted to also point out what is still ahead. As we look at this growth and as we see this demand there, we are seeing continued growth. We have the implementation of Healthier Oregon, previously Cover All People. That will increase our caseload and bring more people on. We have SNAP and ERDC eligibility expansion that's been happening, and those are bringing thousands upon thousands of additional individuals onto our caseload. As we end the public health emergency, that will continue to provide additional opportunities for us to work through things that will add to the work that we have. As we end the public health emergency for SNAP, it's not just coming back and having to process redeterminations. We've been doing redeterminations throughout the public health emergency, but it's doing it in a different way for individuals that are applying. It's helping them understand the information we need. For our Supplemental Nutrition Assistance Program, our food assistance, as we look at that program, we've been doing emergency allotments. We've been providing additional benefits. As that ends with either the state declaration ending or the federal emergency ending, that will mean that individuals may see a reduction in the total benefits. They will be reaching out to our offices. They will have questions, and that's where we will continue to see that workload increase. As we think about our medical benefits, we've been able to use self-attestation. We've been able to do specific actions around those benefits and how we do redeterminations without reductions. We will see individuals that, for example, have received Medicare in the last 2 years have to transition to a Medicare savings program. And there'll be questions about what that means and those transitions for them. There'll be individuals that may not be eligible, and depending on legislation, we will see how we support them through these actions. But each of these add to the complexities that we still have to work through over the next 12 to 18 months as we move through this continued workload and historic demand. As well, we've seen other policies such as the end of pandemic unemployment insurance that happened in September affect our applications. I cannot directly say this is a correlation, but as I shared, we saw our applications increase in September, the same time frame that benefit ended, and we've seen that as continued growth of number of applications as we continue to move through the last several months. And similarly, we have increasing challenges around workforce trends. Retention challenges, we have a record number of workers leaving workforces across industries. There's opportunities. We were an individual that, and as a business working for the state of Oregon, was always an employer of choice in many of our rural communities. And so we're having recruitment challenges as we continue to work in the job market and have to compete at a new way. This is great, again, from a job employment stance. I appreciate individuals being able to go and employ there. As we look at our job opportunities, we have to continue to think about how we use flexibilities in different ways to make sure we can retain and bring on staff. These are just some of the challenges that are ahead for us as we continue to move through and try to meet, again, this high demand and capacity. I'm going to hand it over to Christy Jo now to talk about what we are doing to address this backlog issue and to show some of the success that she and the team have been able to bring about as we work through these issues.
Thank you, Nate. Yeah, I'd like to spend a little bit of time just letting you know what we are doing. So how are we addressing the issues? In December of 21, Oregon DHS did escalate this as a department priority, the backlog, and how can we tackle it and move things forward. An incident management team, IMT, was formed, and it's really there to assess, monitor, stabilize the eligibility application backlog, while also trying to continue to strategize and move forward on the current demands and new applications. We have a 4-pronged action plan that's underway now. The first one is the one system improvements. We are analyzing and have analyzed current change requests that are out there and really prioritizing those that can impact the backlog. One of the examples of this is moving a SNAP to a 12-month certification period to allow Oregonians to have a longer certification and lessen the burden on the Oregonians as well as staff in getting them the benefits they need. The second one is around operational priorities and maximizing the resources we do have. While staff are also meeting the current demand and trying to make sure that we can get new applications interviewed or processed, we are also focusing on past due applications, as well as maximizing resources by bringing on some contract workers that Nate referenced earlier. One of the things in our operational priorities is to look at setting the priorities for how we work the backlog of the applications. Our first priority is people without benefits. How do we make sure that we can get those applications processed as quickly as possible? And then our second is people who are at risk of losing benefits. Based on those two priorities, we really do look at the strategy every week and work through what resources we have to allow us to meet the demand at the door, but also to continue to tackle the backlog and getting people the benefits they need. Two things that we're doing around that is the blitz. We set up a blitz team, and so they are taking some of the they are working the oldest backlog applications so that our staff can look at the current and continue working on anything that is past due, especially around those who are without benefits. The third prong is increasing resources. We are hiring to fill our existing positions as well as hiring contract staff. One of the impacts that we have seen, and hopefully you have as well, is using contract staff to help us lower the wait times on our phone calls and our taking those calls and trying to decrease from those hour of waiting to the 4 minutes, 9 minutes that Nate referenced earlier. And then fourth, we're looking at policy changes. What kind of policy changes can we work through to mitigate the current backlog as well as looking forward at future? What can we do to support Oregonians, removing the barriers for Oregonians to apply and receive the benefits that they're eligible for? So the next slide it is important to me because we are shrinking the backlog. Staff are doing amazing work. Since December 7th of 2021, there has been a 61% drop in past due applications. So our resources are planning, our staff are doing amazing work to try to get Oregonians the benefits that they need. This graph just kind of goes through, if you can see the colors, it indicates each type of program and where we are in the past due applications. And then last, I just wanted to make sure and point out how you can track our progress. So every Friday, there is an update on benefits.oregon.gov to give you more information about the progress. The right-hand side of this slide gives you kind of an example of what you'll see. And again, that will be updated every Friday for you to have a view of how things are going and where we are on it. So I think I'm going to turn it back over to Nate to talk about what's new. What are we going to do moving forward?
Thanks, Christy Joe. So as you shared, we've been making good progress on the backlog. It really is a focused effort. As we've done this work, I want to always emphasize that part of the way we've been able to make progress is by pushing off some of our other work that we could do. As Christy Joe shared, our priority is always on individuals being able to access and gain access to benefits and keep their benefits. And so we've been able to adjust some things because we're in the redetermination period. As that lever ends, we need to continue to look at how we balance all of our approaches to be able to improve things. Um, I talk about this topic, and it's a weedy, strange topic to talk about, but it really is for myself a key to doing this work, and it's really around really bringing together different marginal small gains. How can we look at our operational efficiency, look at our staffing, look at our systems in ways to be able to make small, consistent improvements? And so, as we shared, staffing is one of those for us. We have a current ask to the legislature around staffing to increase staffing related to the work that we need to do. And that's one of our tools. We continue to do training efforts to be able to improve information out there. And we're working across with OHA and ODHS around communication to help improve information for Oregonians. And another one is, what can we do in one? And so there's a couple updates we wanted to share about what we are doing currently in one. And then hopefully, as we get a chance to speak in the future, love to come and be able to engage with you all around other updates and things that are continuing to move in one and the work there. So as we look at these areas, here are just some of the new things that we have available in the one system. Community partners, and hopefully everyone can still see when the screen shrinks there. It always freaks me out for a second there. Community partners can help Oregonians apply for both programs for Magi, non-Magi. That's something that's you all been doing for a while, but I always want to point out we still have individuals in our community that don't understand that. And so they believe they need to go other places. We really can apply for those medical programs across the areas, and the support and work you all do has been a dream of mine and something I'm so excited that we can provide now. Your abilities to access and be able to support individuals in their communities and help represent them and help them get the information in the system is critical to our success. And so that's been an excellent area that we've been able to continue to talk about. That shared case structure, that's still one of those areas that's newer to one. Our information shares across cases. When we collect information on an individual, it updates for their other programs. As I shared previously, you all provided applications in the past, and individuals would take information and they would go into an SSP or an APD office, and we would update their SNAP application, and it would not connect to their Magi application, the previous one. There was no way to share across. And so Oregonians and individuals applying lost benefits or had us come back and give them findings around the fact that they didn't share information. We had errors in audits, and it really affected individuals' benefits. That shared case structure allows our ability to share information more succinctly across areas across the state. Auto association. So you can now associate yourself to medical cases, and if a case does not have a community partner already assigned. Document upload. This was one that I was very happy to see us finally move forward with. It's an area that Vivian Levy and several of us had talked previously about where we need to see a shift associated with this. But you all can now upload a document and provide verification electronically. You can also do that after doing an application. So you can do the application, and before submitting it, there's additional screens that you can upload additional documentation, including things like 231s for auth rep, you're connecting individuals, other verifications that they'll receive. It allows us to get a complete packet of information at one time. Notices, those are an area we continue to explore and look into. Notices are now provided in the preferred language and English on the notice dashboard, so that way while we provide a notice in the various languages, workers and individuals supporting them can see an English version. So that way, we can better help where we may not be able to speak that language, understand what was in the notice without having to have delays and having it translated back or look up additional information. So that was an area that we changed it to try to, as we pushed out notices in different ways for equity, make sure that we're able to be responsive to individuals with questions. As well as you think about notices, I want to call out where many of you have been engaged in different ways. Hopefully you've had the opportunity to engage in ways and continue to have ways to engage around our notice redesign. Our notices improved in the accuracy from a federal compliance standpoint and from a legal standpoint, but they missed the mark in full transparency on what an individual needed to hear. And so as we've done a new approach to our notices, we're talking to individuals in the community, talking to you all and other partners to really explore how we can phrase things in a better way, so that way notices are more transparent and easy to understand what actions are necessary from an individual. We're also looking at ways to update notices so it will share the correct name for individuals. I don't know the right way to say this, and so I'm going to fail as I describe it, but right now our notices use the legal name. We collect preferred name. These are not appropriate terms as we look at it. Yes, we have a legal name that may exist on documentation, but calling out a preferred name, individuals have names. It's how we express and know who we are as individuals, and we should honor that by using that as the way we communicate to individuals through their notices. And so that will be another future enhancement that you'll be seeing in the next couple months. Then we've done data entry updates. We've enhanced data entry experiences and specific income types and other updates as we've moved forward. One of the other things we wanted to be able to make sure you were aware of was this helper bot or chat bot. In Applicant Portal and Worker Portals, we now have a helper bot that allows people to be able to ask questions. As you click on that icon, you can see it displayed here. You can ask a question, and it provides responses back, such as, what's my renewal date? What is the date that my case will be closed, reporting requirements, etc. As you all use it, it helps us refine the answers. When we first rolled it out, we had about a 20% positive response, meaning that it answered a question for an individual. We're now between 50 and 60% of answering questions for individuals when we provide information back. We are doing constant builds and updates to this to be able to better refine the information, so that way hopefully it can assist individuals being able to know what's happening and be able to be aware how they should be moving forward on their case. Finally, resources. Couple things. These sheets, hopefully you see them. They're usually posted, I believe, on some of the websites and information we have for our community partners. But we have tip sheets for applying for benefits. These are available in English and Spanish. These are just key critical things. I know, as I've had a chance to work among some of you all over the years in offices, it just helps for individuals coming and applying and thinking about what they need to have ahead of time. If they can bring their documentation, if they think about when they need to reapply, what information and how they can reapply. Knowing some of those key call times that they can call in there, as we mentioned on call times. Those are just tips and things that we help try to provide to be able to ease the experience for individuals. There's also the One Tip Tuesdays on the DHS social media. These are tips that are provided on a regular basis that can just help people understand what's there. And we've also been able to launch the Spanish version of our Facebook and our communication. So some ways that we're continuing to strive to provide better communication out to individuals. With that, I'm going to stop sharing my screen, and that's the end of our presentation. We want to really be able to, as we shared, move into questions and be able to start responding to some of those. I appreciate, again, the opportunity to talk with you all today and look forward to the questions.
Terrific. Thank you, Nate. We definitely have some questions, and I think maybe I'm trying to think about where to start, and I know that we have some other folks from CPOP to help as well. I think that there are questions about hiring new staff, and I'm going to interject something that also folks have expressed to me, which is that newer staff tend to not have full training. It takes a long time to get trained up, right? So if CPs are calling and they're going to be getting more and more new staff, can you speak to And I think when that happens, there's also an inefficiency. They don't get helped. They need to call back. There are more tasks associated or more phone calls. And I'm wondering if you can speak to that a little bit while we're trying to filter through some of the other questions.
Yeah, absolutely. And, I'll ask Christy, Joe, Maria to jump in as we talk through these areas. So you're right. As we bring on staff and as we're bringing on more staff, it takes time to understand eligibility, understand system, be trained up. As we look at our training right now, it takes 8.5 weeks to move through the introductory training areas for an eligibility worker. So the first 8.5 weeks are spent in training. It actually gets closer to 12 weeks, almost 3 months, when we start to approach some of that in-house learning between training. So part of our goal is they come to training, go explore, do some cases with assistants in their office, come back and continue their training. So that means it can take up to almost 3 months for them to really be trained to get into the system. As I think you all probably understand better than many of us, and from my experience, to be able to become an expert, it takes training and learning plus experience. And experience just takes time. It takes time for us to be able to know and work through that. And that means as people call in for questions, as they need assistance, we have various levels of how much we can provide assistance to you all and to other individuals. Everyone is trying to do their best, and I always want to approach it that way. I assume the best in all individuals, and I believe that's what we're trying to do, is really serve everyone. But you may have new staff that are still trying to learn through it. That's where part of Oregon Eligibility Program really was bringing the supports together. Part of what I'm asking Christy Joe to help us figure out is, how do we support leads locally to build back some of that knowledge? We don't just have eligibility workers. We have support staff, eligibility workers, and leads as really our foundational individuals in our call center, as well as in our local offices. Our leads are individuals that are able to focus on helping build out knowledge and training and information. And so what we're trying to do is find the right way to be able to have leads gain that knowledge, so that way they can support people locally. We're looking at how we continue to do training, or we have right now, take time for training. These are quick sessions that our training groups put on through Oregon Eligibility Program now. And we've done over 40 of these that are recorded and available staff, again, to refresh ideas and areas. We're also updating training as we see complex areas. Long-term care has been an area that staff have struggled with. It's very complex, nuance related to medical. There's over 60,000 individuals that receive long-term care, which is a lot of individuals, but out of 1.4, almost 4 million individuals receiving medical, it's a fraction of the cases. So that ability to gain experience takes time, and so we need to continue to support that as we look at our learning experience. Overall, this is an area that we have to try to balance. I'm sure as you work through the questions, there's questions about how we can better support you all as we look at information. We try to balance and make sure we have staff with knowledge available to answer the calls, specifically as we look at the help desk around applicant portal, and as well as when you call in on specific cases from the community partners. As I shared, you all being able to provide a complete and full application is critical to us being able to do our work. As we support you all, it makes our work easier to be able to do that work and ultimately approve the eligibility for an individual. It's just a balance of what we can with resources. That is why we're pressing on the legislature to help us staff up. If we can bring staff on now, a year from now, we'll be in a different place. We can continue to have more stronger eligibility workers that understand the systems, that can engage with you all and others in a more proactive way. Right now, it really is, how can we bring them on and help them understand where they're at and help them be ready for that work that we have currently in front of us and moving towards us. There's so many questions popping up.
There are so many. Yeah. So I'm wondering, let's see, I'm going to try to give us a little bit of direction here. There are quite a few questions relating to tasks. And I think sort of part of this is that community partners don't have any view into what those tasks look like for workers or how they are worked. So I wonder if I can ask you all to talk a little bit more about the tasks and the process by which you all are resolving the backlog and really making the most of that system that is really the backbone of one.
Yeah, I'll jump in first, and then Chrissy Joe, if you want to add to this. So switching to the one, it became a task-based system. And this is a shift for our workers. When, again, I go to my own reality, it's only because that's how I know my world. And so that's where I go back. When I was a worker, I had my cases. Many workers, exist that way. We had our cases. These people belong to me, and I took care of them. And that's how I approach it from a worker. And if they moved, we had to transfer the case across, we had to move other pieces associated with it, and I had to manually just track and know what I needed to do for each of my cases. Where we moved to is really a task-based statewide system, meaning that we have tasks that get pulled up and it looks at it as a statewide, meaning any worker can update and do any tasks associated with it. And when we talk about a task, it isn't just doing a case, it really is what are all the pieces that we need to do for an individual. So we may have a task around receiving documentation. They have sent in new documentation. That could be a change or related to a request for information. As Christy Joe shared earlier, each of these tasks is then prioritized based on priority logic we built into the one system. This priority logic looks at, are these tasks related to allowing someone to have access to a benefit that currently doesn't as a priority one, or to an individual that without taking these actions will lose a benefit? These are our top priorities. And then it moves down logic to look at other updates and other information that may not be as high of a priority, again, with our ultimate goal of people being able to obtain and maintain their benefits. And so that's how the task logic works. What we've refined over a year of being out now in our statewide, and some of the things that you'll be seeing is how those tasks get pulled. As we've worked with staff around this, we've really been making changes so that way we grab all and can automate all the tasks being pulled. Previous to this, and one of the changes we're bringing forward, a worker had a task and we asked them to go and grab all the tasks associated. Our goal is to serve someone all at once. What we didn't want was to finish a task and then go, oh, oops, you need to call us back, or we need to call you back because we need to do something else. And so we're making some changes to the task logic there to really bring those pieces in there. Some of the tasks that you all may see as we talk about this might be tasks related to member match. That's a very common task, unfortunately, right now that we get, where you all submit an application or are trying to submit an application, and right now we can't match that individual. And there's many reasons that we can't match them. The member match process is heavily driven by federal requirements as we look at the medical programs, especially around what we can match as we go through that data services hub and having access to those areas. And so those tasks come in, and again, those come to a specific priority area. And so staff get those tasks and can work those. What we're also doing is, again, bringing it in so that way we can see the totality of tasks. So if they're clearing a member match, can they then go get that application, make sure the person's associated, add the author rep, and actually process the application? Let's not have it touched 3 or more times. It really is trying to limit the amount of touches and have a worker focused on, just as if someone was walking into us or on the phone with us, taking that application individual as far as they can go to hopefully either have a determination or have clear next steps of what information is still needed to make that determination. This may be an opportunity as we think about that poll and a little bit about future areas where we have some documentation, we can actually show what the tasks look like and have individuals come to show you what a task actually looks like from our side. I know as we've had a chance in some of your areas, we've sat with workers and community partners and be able to show them when it comes in, what the task looks like. Again, so that way we have that shared knowledge to be able to talk through this. Christy Joe, anything you would want to add to what I've described or correct me?
No, I think you did a great job. I would just add that one of the advantages of the system is that you can look at everything that's needed on a case, right, for an Oregonian. So an Oregonian may call and not really understand, the example of some notices. And with a task-based system, especially with the changes we're making, you can look and see everything that's needed to move them forward. So that's going to be a great advantage.
Yeah, and as we get to the next question, I just want to emphasize this is one of the first times we've been able to know we're in a backlog and truly know the level and size. The data that we have now is helpful to be able to know that as we have member matches or other things. We've had applications in the past working with community partners in different ways that we could never say at the statewide what the level is. We heard from community partners and others around some of the issues with member match and data around that. And so we were able to go through the systems and pull up what percentage of cases are getting stopped and what are some of those reasons? And again, we're looking at opportunities and exploring with the policy and operations side to say, are there other things we can do to help with this process? Again, with the ultimate goal that the same way we want to touch things once, you all can touch it, get the application in full and complete. So hopefully the system can make a determination for medical and any approved allowable program that can do that and get that individual benefit, or we can be ready to take our next action and hopefully move as quick as possible to get correct determinations and timely access to benefits.
And I see a question specifically about timelines for tasks. Is there anything we can say about that?
So timelines for tasks. I'm not sure fully. Sorry, I'm trying to look to see if I can find the question specifically for this. So if this doesn't answer, I'm sorry. I will try to for the context. When they pull a task, I expect the task to be worked at that time. We have, in full transparency, I think over 100 and almost 150,000 tasks that are outstanding at this point. So 150,000 tasks that are outstanding at any point in time as we work through this. And we've been able to make some dents into this. I know I was talking to Louisiana and they had 350,000 tasks outstanding, and they just got down to under 300,000 tasks. And so they were excited in their state as they're moving through things. But as we work through tasks, there's different ones, as we shared, come up in a priority area. And so that's why I was struggling somewhat with this. We don't have a time frame associated. We have time frames associated with applications that moves a task up in priority. And so as the staff clicks gets next task, if that task, right now isn't going to affect them losing a benefit, et cetera, it may not come up right away. But if there is a task associated that the individual doesn't have benefits yet, or will lose benefits if we don't take action on it, those move up in the priority logic, so staff will receive those tasks. And as Christy Joe was just sharing, we have logic that we're building out into it to make sure they pull all the tasks. Because again, I might have multiple things that are due or I've turned in that we want to make sure we do all that at once associated. So we may work some lower priority tasks because it's associated with that higher priority task of making sure we complete that case. So I don't know if that fully answers your question, but again, from a task, it really is driven by that priority, and staff are pulling tasks every day as they pull and work this information.
Nate, I think, if I may interject, I think a question that this brings up is that when you talk about the backlog, my understanding, and correct me if I'm wrong, please, is that when we talk about backlog, we mean applications that are more than our required amount of time to process them. So when we talk about backlog, we're specifically referring to applications. And when it's medical applications, we have 45 days. So the backlog is referring to any applications that are farther out than 45 days from being worked. Is that correct?
You are correct. For medical, that is correct.
Okay.
Again, different time frames for different programs.
Right. Thank you. That's important. So when it comes to tasks, do we have an amount of time in which we're supposed to look at tasks? Or is that just a big, long list of things that we need to do? And so that's the first part of the question. But the second part that I'm kind of reading in the questions here is when it's awesome to hear it, there's this prioritization for tasks, which is terrific. But that still doesn't tell us, even if it's coming up as priority, does that mean it's going to be looked at in 1 day, 5 days, 10 days, or 40 days or more? And how do we get a sense of that?
Yeah, appreciate that. So first, to the first part of the question, tasks don't have a set federal time frame associated with them. The applications do. Tasks are something that we just create operationally as we look at this. And so you're correct in that we have like 45 days for an application, and there's tasks specific to applications. So those are time framed. There's certain tasks that have specific time frames as we think about being able to take actions timely. So running certain updates or taking actions so that way we can appropriately send out notice and do those things. And so that's a little bit of our nuance as we think about that task process associated with this work. To the time frame to be able to move through tasks, this one, I struggle with being able to provide the right level answer, and I might need to go back and do some additional research to be able to provide some better answers associated with it. We process thousands upon thousands of tasks every day. As we move through this, we know each worker can do on average 4 applications, 4 renewals, or 3 changes on top of answering questions every day. That's an average we see. We see people do more than that and less than that, depending on the workload and the complexity of the item they're trying to move. As you think about a task, I can't say for each task right now, this task will be followed up within 2 days or 3 days. It depends on the demand at that time and the number of tasks and things we see. During high periods of redeterminations coming due, that obviously affects our ability to get to other changes or update tasks. And so those are the nuances as we flex our work, as Christy Jo described. It's literally a weekly thing as we look at this work about how we adjust and look at our work and make sure we're focused on that priority areas around benefits. I don't know, again, Christy Jo, Maria, if there's anything to add. It might be an area we'll take back and continue to see if we can provide a better answer about average timeframes or ways to provide you some data as we look at this.
I would love.
Yeah, I think, oh, go ahead.
Go ahead, please.
No, I think we ought to take it back and look into it more about the specific, like, I think what we're talking about is P3 task, right? Some information is received. How do we act on that? And then also how we can impact that with the build we're talking about, which is if you're in one task for an Oregonian, all the tasks are then there, no matter what their priority is. So we can tackle it that way as well. But let us get some more information.
Yeah, I think that all these other things, task is a very broad word, right? It's all that other stuff that gets associated with an application in order to bring it over the finish into getting benefits. And a lot of people are experiencing member match tasks more and more these days, and they're having to call 3 or 4 times to get that cleared. So I think there's really something to explore there. We don't have the I don't think we have the time to fully do that today, but we'd love to figure out how to continue that conversation with you.
Yep.
To learn more.
Nate, I do want to clarify that if you have turned in information related to an application, that is a part of the work we're doing and strategizing. So if you are an Oregonian without benefits, that includes us working any of those information received tasks that's related to the application. So we are focusing on that as well as the application that's out there. I'm not saying that we're I guess that where I am is that is a focus, and we're continuing to work and dwindle down those, but that's included in the backlog of the application conversation.
Okay,
yep.
Good to know.
And as we talk about it, just really quick, if I can, on the member match part, it is an area that we are exploring. When we look at applications received since August of 2021, 61% of those submitted by community partners were able to go through successfully. That means 39% of those were stopped for some reason. And I think that's the pain point. And we've seen an increase in this in the last couple months. The majority of those are for partial match between MCI and CI. We do see them stop for other reasons around head of household construct or authorized rep information. But as we look at it, we're looking at it, we've seen the last 3 months over approximately a 20% uptick in applications that run to a member match issues. And we know some of the primary reasons. Not having a social security number, there's lots of reasons we don't have social security numbers, newborns, other individuals that we serve, but that's part of the logic currently. And so we're talking about how we can either require it or look around fixes around it, or what are some of those adjustments we can make around it, as well as other ways as we match individuals in our data. There was some areas that we had a risk when we first went live that allowed individuals potentially to have access to data that wasn't theirs. And so we took action to avoid that happening. And in taking that action, while it makes things more secure, it also creates more scenarios for a partial match that then, as you all were describing, requires a worker intervention. And so that's some of the areas that we're currently literally regularly in email right now talking across with Deloitte as our vendor, but with policy and operations to say what are some of those opportunities. And hopefully we'll be able to bring back some of those updates in the future.
I hate to interrupt this because there's so much good information and some of it is quite technical. I also recognize that we're starting to run short on time and that there is a lot of hunger for more information in a lot of different directions that I'm seeing from community partners. So I just want to say that out loud, like we are seeing your questions, we are logging them. There's no way we're going to be able to get to all this content today, but I think it's giving me a lot of good thoughts for places we need to focus our future monthly webinars on and to dig more deeply. Even just this conversation about tasks, I think having a visual and having something ready is going to really help those conversations. So pardon me for the long reset, but I'm going to attempt it. And Deanna, I don't know if you want to maybe take us to the next step, and we'll have plenty to talk about in the near future.